This is subacute appendicitis complicating to intestinal obstruction. This is a 21-year-old male. The recent last year, this October case is there. Emergency room scenario. Patient had a bad abdominal pain since 8 days, nausea, vomiting immediately after eating and drinking, yellowish vomitous, greenish, non-offensive. He has not passed urine stool since 5 days and flatus has not passed. Are you able to see stool not passed since 5 days and not passing flatus and vomiting with nausea? So on examination, there was a distended tenderness in epigastrium and periumbilical region. There was sluggish bowel sound and increased abdominal girth. So pain in right iliac fossa, 4 months back, which has come back now. So mildly dilated appendix, no localized mass or collection, sign of appendicitis. Is a finding of sonography. Surgeon suggested appendectomy. Was it a recurrence of appendix? The only other problem was there were signs of obstruction. What about stool and flatulence? So we tried to find out a clinical work. And then we thought that until a surgeon comes and do the surgery, we have got a time and whether we can prevent the surgery. You can see the X-ray. Is the water, air and water level visible? So this is a classical sign of intestinal obstruction with the dilated bowel loops with feeble peristalsis. No stool and no gas since 5 days. So what we are dealing with is an subacute intestinal obstruction. Appendicitis, inhibitory effect, paralytic ileus, and small bowel obstruction. So crampy abdominal pain comes and goes, constipation, vomiting, inability to have bowel movement or pass gas, sluggish bowel sound, USG with now the intestinal obstruction secondary to subacute appendicitis. What can be the complications? Necrosis, gangrene, perforation, and peritonitis. These were the things which were prescribed by a surgeon: antacid, antiemetic, antibiotic, analgesic, laxative, nasogastric tube insertion. But there were temporary relief for few hours, nothing improved. So we tried homeopathy, nothing improved. Was an issue and surgeon said that I may have to operate in an emergency and will not be able to wait till next day. So we thought that why not try homeopathy? So then we started exploring the patient. Patient was very calm. He doesn't complain anything about illness, even though he has severe complaint. There was so much of pain, cramps, distension. He was very calm. He was not complaining about illness. Now, these are the observations which are important when the patient is in a ward, in a hospital, and they make and break the cases. So it's not, very simple OPD observations. These are observations which you make when the patient is in distress. So we made again Boger. We resort to Boger. So subacute to acute, bowel, nerves, and autonomic nervous system, of paralytic atony, obstinate constipation. Well says he is when sick and placid. The repatriation brought in opium and Nux vomica. So we studied the comparative of opium and Nux vomica. both the digestive tract with muscular coat and muscular mucus coat. It's the neuromuscular system of the bowel is more involved. Opium has got more paralyzing influence on the whole alimentary canal, insensibility of nerves, sluggishness of function, diminished secretions, and exhalation from whole canal. The Nux vomica has got more inflammation, disorganization of nervous energy, depression of nervous system, increase the action of intestine, spasm, and irregular peristalsis is something which is known in Nux vomica. So there are certain things which are common to both, but there are certain things which can differentiate. The Nux vomica has got constipation. The opium is spasmodic retention of feces, especially small intestine, and long-standing constipation. The mental state of Nux vomica is irritability and violence, very aggressive, even during acute with the pain. And the mental state of opium is well, calm when he is sick. So we referred the Boger synoptic key, the mind, nerves, brain, cerebrospinal, sympathetic, digestive tract, negative torpid state, but little pain or secretion or reaction, paralysis, bowels, twitching. Okay, nothing ails him. Placid says nothing ails him. Sluggish, bowel feel obstructed, paralytic atony of bowel and bladder, constipation. So opium covered all the part of it. So we prescribe opium 200 4-hourly. And we did a comparative study with allopathy. The 4 days of allopathic treatment yielded nothing. Patient deteriorated. After homeopathy, the abdominal pain and intensity 0. Vomiting frequency improved. The character of vomitus though was same. Stool did not pass the next day. Flatus, he started passing flatus. That was the first sign of improvement. And you can see the abdominal girth has decreased. The bowel sound has improved, even though they are sluggish. Now you can see the difference after 3 doses. Next day, passed the stool, hard stool, scanty, flatus passed, and the abdominal girth, which was 72.5, has come down to 67.5 with the normal bowel sound. So it went on improving with the 66 centimeter, and now you can see a normal, the fluid air level has reduced significantly. What you can see is a gaseous shadow more. Is almost with opium 400. The patient was defined, the complete case taking was done. His constitutional remedy was China 200, and he was discharged on China 200.